parenting tips. What can you expect during the first few visits to the pediatrician? The first visit to the pediatrician usually occurs within the first week of your baby's life. The pediatrician will check your baby from head to toe and watch for the degree of weight loss since birth. Up to 10% of weight loss is considered normal. The following visits to the pediatrician usually occur at 1 month, 2 months, and 4 months of age. These visits correspond to immunization visits. During these visits, your pediatrician will check your baby's growth by measuring his head, body length, and weight, his eyes for visual tracking and alignment, and ears for infection or fluid. The doctor will also listen to your baby's heart and check his lungs and abdomen for abnormalities. It is a good idea to bring a list of questions and concerns when you visit your pediatrician to make sure you get all the information you need. Here's a good rule of thumb. During the first 2 months of life, take your baby to a doctor every time he has a fever over 100 degrees Fahrenheit. How will you know if your baby is suffering from allergies? Allergies are caused by a variety of agents, from pollen to certain foods to laundry detergent. Most allergies take time to develop, but some manifest very quickly. Food allergies, for example, can be found in 1-week-old babies. Symptoms of food allergies in babies can be feeding problems, colic, gas, constipation, spitting up, frequent ear infections, and skin rashes around the mouth. Most food allergies come in clusters. That means if your baby is allergic to cow's milk, he might be allergic to other things as well. If you think your baby might have allergies, consult your physician. He might suggest that you change your baby's formula to soy-based formula. Keep chemical exposure to a minimum by using organic foods and eliminate soaps, lotions, and fabric softeners. If you are breastfeeding your baby, you might want to change your diet, since your baby might be getting some allergy agent through your breast milk. Wheat, eggs, nuts, and cow's milk products are the most common allergenic foods. Teething occurs when your baby has new teeth pushing through their gums. That can be a very painful process. At this time, your baby will want to chew on things. And you should let him, since the process of chewing actually helps the teeth erupt through the gums. Also, the chewing and pressuring of the gums helps with the discomfort your baby feels. Signs of teething are drooling, irritability, crying, and of course, chewing anything they can put in their mouths. Babies can start teething as early as 2 months of age, but the teeth might take months to erupt. Here are some things you can do to help your baby's teething discomfort. Apply something that numbs the gums a little, or something cool to bring the swelling down. You can freeze a wet washcloth and let your baby chew on it. Give them safe things to chew on. Be careful with teething biscuits, since these can break off and become a choking hazard. You can also massage your baby's gums or use homeopath remedies. Teething will happen at its own pace, but once your baby has teeth, don't forget to clean them. How do you keep your baby's smile healthy? Here's some tips. The first teeth appear at age 6 to 10 months, and usually by age 3, all 20 baby teeth are in place. Once the teeth come out, it's up to you to clean them. As soon as there is one tooth in your baby's mouth, he can get cavities. When your baby has only a couple of teeth, you can use a piece of gauze to wipe and clean them. Avoid milk bottle syndrome. Don't put your baby to sleep with a bottle. The milk sugars will cause decay. At 18 months, you can start brushing your baby's teeth in the morning and before bed. Use a toddler toothbrush with soft bristles and kids' toothpaste. You can take your toddler with you to the store and let him choose his own brush. That might encourage him to brush without a fuss. To help good habits, let your toddler brush, and then you brush his teeth. Take your child to the dentist for a checkup between the ages of 1 and 2. Statistics show that in his first 3 years of life, your baby might get sick 3 to 8 times a year, and even more times if he is going to daycare or has a sibling. Symptoms of the common cold in children are runny nose, sore throat, coughing, and low-grade fever. The flu has similar symptoms that are more severe and at times also vomiting and diarrhea. If your baby has a cold or flu, you can clear your baby's nose using a suction bulb. Your baby will not enjoy this, but it's important to do, especially before feedings. Put a cool mist humidifier in baby's room. Offer extra fluids, especially when the fever is higher. You can give your baby some medication to lower his fever, but consult your doctor first. Watch for decreased feedings and urination. Those might indicate your baby is dehydrated. Watch for persistent symptoms. A cold or flu usually lasts 5 to 10 days. If they last longer, call your pediatrician. If your baby is under 3 months and running a fever of over 100 degrees Fahrenheit, call your doctor right away.
Subscribe now